This presentation tries to explain the PBL process. This will help us to be standardized to facilitation, as the guide to individual PBLs will also be aligned to this process. Myself, Dr. Pullikotal Shaji Jacob, Senior Lecturer, School of Dentistry, International Medical University. Presently also the Chair of PBL Committee when this video was made. Maastricht Medical School can be considered as an earlier pioneer in PBL-based education. The 7-jump process explained by Schmidt has been practiced and perfected in this school. It is also one of the widely used process in facilitating and conducting PBL. PBL in the School of Dentistry, International Medical University, is conducted over 2 days in a span of 1 week. In the first day, the students get the trigger. The trigger is usually a clinical or clinical oriented scenario with a problem. Of the 7-jump approach, on the first day, the 5 steps are done with the last 2 steps in the second day of the PBL. The 7 steps as outlined on the slide are: Step 1, to clarify the terms and concepts of the problem scenario; 2, to define the problem; 3, to analyze the problem; 4, to construct a working hypothesis; 5, to formulate learning issues. All these 5 steps are usually completed in the day 1 of the PBL. Step 6, self-directed study, and 7, synthesis and report are done on the second day of the PBL. I will try to explain these steps using a PBL trigger of our school. This trigger is for semester 2 of the year 1 students. The PBL introduces the students to diseases and its manifestations in gingiva. This slide shows you the outcomes to be achieved by this PBL and involves: 1. To recognize the different diseases affecting gingiva, to explain the pathogenesis of gingivitis, to explain the importance and role of biofilm and individual bacteria in causing gingivitis, to compare between normal gingiva and inflamed gingiva, to explain the importance of prevalence and natural history of gingivitis in a population and in particular Malaysian population. Step 1 involves clarifying any terms or difficult concepts. Allow the PBL group to handle this, and as a facilitator you can chip in when you find that there will be any difficulties in moving forward for the group, or to correct their path in this PBL. Please remember, as a facilitator, think twice before you step in. In this second step of the 7-jump process, the group tries to identify and define the problem. There can be one or a few problems. In the trigger we just saw, bleeding gums of Raj can be a problem or a phenomenon. Students learn by explaining this problem or phenomena in terms of underlying processes. So in this problem of bleeding gums, we are trying to achieve the PBL outcomes outlined earlier. The students are to understand this problem by thinking aloud. They can see the different perspective of this problem from Raj's perspective, from his friends, or the dentists. Step 3. Analyze the problem. Here the prior knowledge is brought to the fore to understand and explain the problem. The students have learned normal oral tissues, and also they would be exposed to general physiology and pathology. These all can come to analyze and get a hold on the problem. Step 4. Constructing a working hypothesis. I feel that this is a very crucial step in student learning. The students construct hypotheses to their problem. The hypothesis can be based on their prior knowledge or their assumption based on some rationale. They may not have sufficient knowledge to prove their hypothesis. They will be finding the missing links to be able to prove their hypothesis. Few hypotheses can be: Raj has bleeding gums as he does not brush his teeth. There should be evidences and logical flow to support the hypothesis. It can be like not brushing one's teeth will lead to more plaque and to other things which can ultimately lead to the bleeding gums. The missing links will be filled as the group searches for the literature to find evidences, and this will also help them learn. A problem should have at least one hypothesis. All hypotheses Further relevant problems should be recorded, as this will be revisited in the second session of the PBL to be accepted, rejected, or modified. The missing links which will help the student to verify the hypothesis will become the learning issues. The PBL trigger has been designed so as to bring out the learning issues. Few learning issues can be like effect of bacteria on gingiva or mechanism of bleeding. Either all members of the group can complete all the tasks individually or can be shared. But on the second day of the PBL, when the problem is explained through hypothesis, every member should have knowledge. Here the students go to self-directed study. Internet, library, experts, senior students or other faculty members can be resources. They are required to share among themselves so everyone has the same knowledge. On the second day, the group is required to present their findings and knowledge to explain the problem. After explaining the learning issues, they revisit the hypothesis. They accept, reject or modify based on the light of new knowledge. The problem is revisited and a solution is proposed. Kindly get feedback from the group and the students on the learning experience. Thank you.